Good morning. I'd like to call to order this hearing of the House Health, the Finance and Policy Committee. Though a quorum is present, the first order of business is approval of the minutes of February 2nd, 2023. Representative Smith.
I move to approve the minutes from the last committee meeting.
All right. Thank you, Representative Smith. So is there any discussion to the minutes? Seeing none, all in favor of approval of the minutes, please say aye.
Aye.
Any opposed? The motion prevails and the minutes are approved. Okay, so before we get started on the first bill, I just wanted to announce that we received many letters for the hearing today, and so those we did not make copies for the public of the many letters that we received, but they are all available online on the committee webpage. So just want to make sure that everybody knows that. It's been quite striking coming back in person how much paper we generate, much of it gets wasted. So we're trying to figure out how to be efficient and still be transparent and give everybody the information they need. So it's a work in progress. All right, so the first bill on the agenda is House File 51, and so we have Representative Richardson. And Representative Richardson is not on the committee, so the chair will move House File 51 to bring it before the committee, and the intention is that it will be laid over for possible inclusion in an omnibus later on. So the bill is before us, and Representative Richardson, you have an author's amendment, but I don't see it here. Oh, we don't have, I guess we don't have the amendment. Okay. All right. Well, we don't have copies of the amendment, Representative Richardson, so maybe what we'll do is let you just go ahead. Ms. Niedernhofer is going to get that copied, but you could just go ahead, if you would, and describe what the changes are if they're substantive, and go ahead and present your bill, and then we'll catch up and actually adopt your amendment. I'm sorry about that.
No worries. Thank you, Madam Chair. So, Madam Chair, House File 51, as amended, establishes the Emmet Lewis Till Victims Recovery Program with the Minnesota Department of Health with a one-time appropriation of $500,000 from the general fund in 2024. The bill would require the Commissioner of Health to develop a culturally informed grant program for victims and families who have experienced significant trauma related to violence, false accusations, wrongful convictions, and hate crimes, and activities that have devastated families. It would also require a report to come back to the legislature. The bill would require health and wellness supports, remembrance and legacy preservation, and community resources and services to promote healing. The research is clear that unresolved trauma impacts people's future health. When trauma goes untreated, it festers and increases risks of mental health diagnoses, physical risks such as high blood pressure, stroke, or heart attack, self-harm, suicidal thoughts, or ideation, just to name a few. To be clear, families and communities are hurting, and there have been a number of experiences of unrelenting trauma on trauma, because when we hear names like George Floyd, Amir Locke, Philando Castile, Kobe Heisler, Jamar Clark, or the names of Taylor Hayden and Brittany Clarity and so many others, so many more names than we have time to name, there's a clear need for dedicated resources for healing and support. This bill is focused on ensuring that there's access to resources and supports for victims and families that are hurting in the aftermath of such traumatic experience. Madam Chair, I'd like to yield my time to my testifier today to share about what this bill would mean to them and their family.
All right, thank you, Representative Richardson. So first on my list here, I have Deborah Watts. Welcome to the committee. If you would just introduce yourself for the record and then go ahead with your testimony.
Thank you. Madam Chair of the Health, Finance, and Policy Committee and staff, along with members, thank you. My name is Deborah Watts, co-founder of the Emmett Till Legacy Foundation and a cousin of Emmett Lewis Till, who at the age of 14 years of age was brutally murdered in 1955, nearly 68 years ago, just down the river south of here in Mississippi. On August 21st, in 1955, he traveled from Chicago south to Mississippi to visit relatives, just to take a vacation. Just a few days later, on August 24th, while visiting a store in Money, Mississippi, he whistled at 21-year-old store owner Carolyn Bryant, now known as Carolyn Bryant Donham. In the early morning hours on August 28th, in 1955, her husband, Roy Bryant, and his half-brother, J.W. Milam, kidnapped young Emmet, and at gunpoint from his great-uncle's home, they ventured some 30-some miles in a torturous journey that we now call the Till Trail of Tears and Terror. Emmet was beaten, he was lynched, and shot in the head, and with a 75-pound cotton gin fan tied around his neck with barbed wire, he was thrown in the Black Bayou. And on August 31st, his badly beaten, decomposed body was pulled from the Tallahatchie River. His mother, my shero, Mamie Till Mobley, a mother of an only son, through her unspeakable pain and trauma and grief, as you can imagine, but also her courage, she decided to allow her son's monstrous-looking appearance to be viewed during his funeral on September 3rd by insisting on an open casket funeral. Seen by thousands who were left horrified and traumatized by bearing witness to the ugliness of racialized violence, yes, a lynching of her only precious son, Emmet, or Bobo, as she affectionately called him. By September 6, 1955, J.W. Milam and Roy Bryant were indicted on kidnapping and murder, and on September 19th, the trial began. On September 23rd, the jury rendered a verdict of not guilty with only 67 seconds of deliberation. In 1956, they were paid $4,000 for their story, an exaggerated confession that appeared in Look magazine. So they actually confessed, but they were acquitted. Well, this type of violence and injustice occurred back in 1619 when the first slaves arrived in the British North America. And so historically, according to a recent statement by Congressman Bobby Rush, and it was sponsored by many in Minnesota as well, he authored the Emmett Till Anti-Lynching Act now, that is law. There were some 6,500 lynchings that occurred from 1870 to 1950. And based on the expert research of the Equal Justice Initiative, Lynching in America and Other Lynching in America documents, this was a problem in America and still occurs. And we have to go back to bring this forward. But most importantly, as Representative mentioned, I'm sorry, and I'm kind of choked up because this is an emotional time for me. I just want to say,
We
I
understand.
never
Take your
thought I'd be
time.
here. I just want to say that.
We appreciate that you're here, and take
And,
all the time you need.
Okay. So in 1955, Mamie Till Mobley, Emmett's mother, like many mothers today, thought about ending it all. But for her, the thought of a child possibly finding her without having her fashion-forward pants on, that made the choice for her unthinkable. Because in 1955, most women weren't wearing pants, right? So if she jumped, which she thought about that, at the brink of her grief and pain. So she lived through that pain, fighting for 47 years without the benefit of therapy or any targeted or intentional support to maintain a healthy way to recover. And this all took a toll on her both mentally and physically for a number of years. Without the adequate support or resources, she had only the memories of her son, the sympathy and the embrace of the world to sustain her. Karen Wells, the mother of Amir Locke, who was shot and killed by police in Minneapolis, executing a no-knock warrant a year ago, she was barely strong enough to give her testimony during a hearing for this bill heard last year. But she knew how important it was to get this done and get some support for her family. But she said during a recent interview, mentally, in order for me to get through the day, I basically just have to tell myself that Amir is on vacation. My heart don't beat the same anymore. It does not beat the same. It's broken. It's never the same. The best surgeon in America could never repair my heart after what they did to my son. So unfortunately, that same theme is shared by mothers, fathers, siblings, children, and a generation of family members, and that in many instances suffer in silence. But many thanks to many organizations like the community-based organizations in the Twin Cities, Communities United Against Police Violence, CARE, Minnesota, they've recorded over 400 names of known victims of police brutality and violence and other types of violence in Minnesota, as shown on this poster. This is Minnesota, ending at George Floyd. And other organizations like Families Supporting Families Against Police Violence, Justice Networks, they're giving a much-needed voice and looking at various solutions in public safety to support those families who are bonded by a common theme of loss. We certainly, as an organization and those that have lost loved ones, aren't attempting to right all of the wrongs of the past. But this bill, the Emmet Lewis Till Victims Recovery Program, is an important step that we in Minnesota, due north, the star of the north, can lead the nation by helping families of victims and their heirs recover and gain their footing to begin a more empowered and sustainable journey towards healing mentally and physically from the loss of their loved ones. As we think about the impact here, there are just a few names that I'd like to mention. Certainly not all of these on this poster, but I would like, as we customarily in this circle of loss and grief, we say their names. And in a march that was held July 30th of last year, I would like to just read these few names here. Say their names for Tekle Sundberg, Winston Smith, Travis Jordan, Jamar Clark, Dalal Eid, Justin Tagan, Brian Keonis, Jafford Smith, Demetrius Hill, Dante Wright, Cordell Handy, Thurman Blevins, Courtney Williams, Lionel Lewis, Marcus Golden, Walter Collins, Philando Castile, Kobe Dimmick Heisler, Chaser View, Paul Castaway, Isaac Aiden, Hardell Sherrill, Fong Lee, Emmett Till, Phil Quinn, Dontello Wright, Deanna Marie, George Floyd, Noah Kelly, Christopher, Amir Locke, Marcos Paramo, Elijah Thomas, and Billy Hughes. Just a few names. So this impact, the impact of this bill, and we believe that there is a void right now, and this will help to fill that void. We know it's not perfect, but it will be a step that I think that Minnesota can take to be a shining light on repairing and helping these families recover in their lives to move forward.
All right, thank you. Thank you very much for your testimony. Next, we're going to have Carrie Johnson Heisler.
Madam Chair,
Representative Richardson.
they were unable to make it today.
Okay, and what about Valerie Castile? Is she here?
She's unable to make it today as
Okay.
well. I think it's just,
All right, thank you. So we now have the amendment. It's just being passed out. Let me just see if there's anyone else in the audience, in the public, who wishes to testify on the bill. Is there anyone else who wishes to testify? All right, I'm not seeing anyone, so let's just give it a little moment here. Representative Richardson, do you have a copy of your amendment?
I do.
Okay,
Yes,
maybe you
Commissioner.
want to just describe it while we're waiting for it to be passed out here.
Sure, Madam Chair. So the amendment to House File 51 clarifies eligibility for the grant funds to include victims who have experienced trauma, including historical trauma resulting from events such as assault or another violent physical act, intimidation, false accusations, wrongful convictions, or hate crime. It also clarifies the dates within the bill as well, related to reports that would be due from the Minnesota Department of Health.
Okay, so the chair will move the adoption of the A2-1 author's amendment that Representative Richardson just described. Is there any discussion to the amendment? All right, seeing none, all in favor of adoption of the A2-1 amendment, please say aye. Aye. Any opposed? No. The motion prevails and the amendment is adopted. So with that, any discussion, members? Representative Baker, or Backer, sorry.
No problem. Yes, Mike.
And you might need to try to, I know it's awkward, but if you can talk into the mic.
You're right.
Yeah.
Madam Chair, to the author of the bill, was wondering with this new program, how many individuals would be served with this new program? Thank you.
Representative Richardson.
Thank you, Madam Chair, and thank you, Representative, for the question. So the bill would allow not only individuals to be served, but it would also allow for memorials to be established as well. And so that would be a question in terms of looking at how much of the funds would be for direct care versus memorials as well. And so that would be done by the bill in consultation with the Commissioner of Health, along with victims who have experienced these sorts of traumatic experiences.
Representative Backer.
And thank you, I appreciate it. So if I'm hearing you correct, I want to make sure I'm interpreting this correct. So the commissioner will make that discretion on if it's going to be for individual or memorial. Any projections? Are we able to serve 10 people, 20 people? Just was wondering what that is. Thank you.
Representative Richardson.
Thank you, Madam Chair, for the question. Thank you, Representative Backer. In terms of the work here, the goal is to really have this be a community-driven process with the community working alongside the commissioner to determine what that would look like. We know that we have, as this list shows, many families who have been impacted here, and we want to ensure that they are part of the process in determining what the $500,000 appropriation would look like, knowing that they are navigating through some pretty traumatic experiences. So at this point, that would be in consultation with those surviving family members.
No further questions.
All right, thank you. Representative Nadeau.
Thank you, Madam Chair. Thank you, Representative Richardson. So I guess the answer to Representative Backer just confused me. Can you expand a little bit on the memorial, I guess? When I read the bill, and I've had some experience in my day job actually working with and attracting culturally specific providers to provide trauma therapies, supportive services, and it's difficult, really difficult. And so as I was reading the bill, I was looking at this, and that's how I looked at it, is that this was actually to provide direct services to victims who've experienced violence from a government setting, from whatever the case, based on the eligibility. But is that not the case?
Representative Richardson.
Thank you, Madam Chair. As the bill states, it is to provide not only direct services, but it also can provide for memorials for families, so it's a both and.
Thank you.
Representative Nadeau.
I just can't see that in the, where, can you point to the line that talks about memorial? Maybe it's in the amendment. I'm sorry, I just don't see it.
Representative Richardson.
Thank you, Madam Chair. On page 1
And here's the
of the bill, line 121, line 122, they all talk about the various aspects that the funding can be used for. Starting on line 1.19, health and wellness services, which include services and support to address physical, mental health, cultural needs, spiritual and faith-based needs. Number 2, remembrance and legacy preservation activities. Number 3, cultural awareness services.
Thank you. Any
Thank you, Madam.
follow-up, Representative Nadeau?
Yes, and so, just so that I'm, to be clear, so that means a memorial? So that's a memorial?
I think that's what she's saying,
Okay.
yes.
Got it. Thank you, Representative Richardson. Thank you, Madam Chair.
All right, thank you. Representative Quam.
Thank you, Madam Chair. And to the author, looking at the amended language, I'm trying to understand, is this limited to historic events in Minnesota? Or is it more broad? I don't see any limitations, so it could be from anywhere.
Representative Richardson.
Thank you, Madam Chair. The focus of this bill would be to serve residents of Minnesota.
Follow-up, Representative Quam.
Well, actually, clarifying the question wasn't for residents, it was for events. So is it just events that have happened historically in Minnesota, or I'm not seeing any language to clearly delineate a limitation that we're just looking at Minnesota events. So I'd like clarification and an answer to the first question with that clarification.
Okay, I'll let Representative Richardson answer, but, Representative Quam, when we treat people for whatever we treat them for, we don't ask whether they got their mental illness or whatever it is within our borders. We just treat residents.
Madam Chair, I
Representative-
just wanted clarification, because when we write law, we need to have it specific, because courts will, if it isn't specific,
Yeah.
right, so the
Representative
author.
Richardson.
Thank you, Madam Chair. This bill would ensure that people who are surviving family members that are residing in Minnesota would have access to services, and the funds that are associated with this bill will be in direct relation to people who are in Minnesota. And I think it's really important that we recognize when these tragic events happen, the Tell family lives here in Minnesota. And so if you have individuals who are in need of help and support because of mental health needs or traumatic services, I don't think that we should draw the line and say that because their trauma occurred outside of the state that they're not eligible. So this would ensure that people who are residents of the state who are in need of culturally specific support would be able to receive that.
Thank you. Follow-up, Representative Quam, and then we're going to.
Yes, Madam Chair. And I understand the authors, I just wanted clarity, but that means that any person who has a family connection to the Holocaust, that's in your amendment and in the original bill, including historic trauma, and that was a very large historic trauma, would be included. And then if we look at the FBI, they keep a record of annual hate crimes, and many years over the decades and decades that they've done that, the largest individual group has been the Jewish community. And so as I'm reading this, there's a very broad group of people living in Minnesota that would be included in this. And is there going to be, I'm not saying anything here, it's discretionary to the commissioner, so I'm not seeing any criteria delineating between any specific types of events other than hate crimes and historic trauma. So I just wanted, the members and the author to realize without some clarifying language, this is an extremely large pool. And I'm trying to understand, how we're looking at addressing this. Thank you, Madam Chair.
All right, I'm going to go on to the next member, and, maybe in a further remark, Representative Richardson will want to incorporate that, maybe. So Representative Hemmingson-Yager?
Thank you. It's more of a comment than a question, but thank you. I just want to thank you for kind of bringing this up, especially with this lens, and I feel this comment is appropriate being on the Health Committee as well. We owe a lot to our scientific discoveries and our medications due to a cell line who was taken from a Black woman named Henrietta Lacks. So anybody in science who has heard of HL60, those cells were taken without her knowing and were cultivated. It's an immortal cell line. And, her family continues to struggle because they were not taken care of. So I just kind of want to point that out too, that this has broader implications than just the violence that is experienced that Representative Richardson and her testifier describes. So I just kind of want to, in point of information, I guess. Thank you.
Okay, thank you, Representative. Representative New Brindley and then Murphy. Representative New Brindley.
Thank you, Madam Speaker, and Madam Chair, I've promoted you. Representative Richardson, I'm looking at the evaluation portion of the bill, and I guess I might ask Madam Chair if there has been a fiscal note requested on this bill?
This is a bill with an appropriation. I don't know if there would be a fiscal note.
Chair Liebling, Representative New Brindley, a fiscal note has been requested. It hasn't been completed yet.
Okay, perfect, thank you. Thank you for that, Madam Chair. I assume I may continue. Thank you, Madam Chair. My question, Representative Richardson, under the evaluation of the program, grant recipients must provide the commissioner with information required by the commissioner. And then on line 2.11, this report must include information on the operation and results of the grant program to the extent possible. And I'm wondering if you can talk to us a little bit about what your vision is for that. What kind of metrics might be considered in that? What kind of outcomes are we hoping to see from this particular grant program?
Representative Richardson.
Thank you, Madam Chair. Thank you, Representative New Brindley, for the questions. As MDH does a lot of contracting throughout the year. Typically, what they are evaluating is not only the number of people served, but also outcomes that would be related to receiving service in terms of how folks are functioning. And it's also an opportunity to be able to look at impacts, thinking about, for example, cultural awareness or any sort of community sort of gathering, being able to provide the outcomes of those types of activities.
Representative New Brindley?
Thank you, Madam Chair. Wait, did you just call me Senator?
No.
Oh, thank heaven. I thought that's not a promotion.
Representative Murphy.
Thank you, Madam Chair. I'd just like to say that there wasn't a day that went by in my campaign where I didn't honor Emmet Till. And I honored him because he's the turning point. This story is the turning point. His mother is the turning point. Not only the civil rights, but human rights. There's a lot of people that for the first time recognize that this was just not right. These atrocities were way over the top. So it's about human rights too. Only the way a mother could show she took those steps to have that wake and show the atrocities, and that was the turning point. 4 months later, Rosa Parks sat on the bus. And so it was a really turning point. What I'd like to see a little bit more of in your bill is the talk about human rights. We all agree. The reason I told this story and I was so committed to it is it's about human rights. It's just wrong what happened. And we need to correct the wrong. But it's not just civil rights, it's our human rights. We're all part of that. And I think that is his story, is that he was the first one. His story, his mother, was really the first ones to get us all to really look at our human rights. And what we were doing was not right. So anyway, I'd just like to plant that seed and to see if you've considered at all maybe adding more things about human rights in there, because I think it's for all of us, not just, not just for, and I think it would go more to tell the story for Emmett Till too. That is his biggest contribution, is he turned the hearts and minds of many.
All right, thank you. So that's all the member comment we have. I'm just going to make a brief comment, and then I'll turn it over to you for a final word, Representative Richardson. So I think, first of all, thank you to Ms. Watts for your wonderful testimony. And what I think is really unique and compelling about this proposal is it really talks about trauma and about trauma in communities in a way that we really haven't done. And I think in the legislature in the last several years, in part due to efforts of people like Representative Richardson, I think that the legislators are becoming much more aware of the impact of trauma and the impact and meaning of historical trauma and how these things can play out in people's lives today, that we're all products of our history and products of the stories we were told in our families. I don't mean stories that are made up, I mean stories of our history, and how those things can impact people and affect them, and impact communities and affect them. And so I think this is a really important bill that brings this to the forefront and says, let's see if there's a way we can change the course for people who have been impacted. So I think it's very interesting. Obviously, it's, I guess we didn't ask you, but it seems like this is really kind of a new concept of how do we address trauma in communities as well as with individuals. So I appreciate the bill very much, and thank you very much for bringing it, Representative Richardson, and please go ahead and make a closing comment.
Thank you, Madam Chair, and thank you for the discussion, members. And I want to thank Ms. Watts as well for coming back again to share a very difficult story. I think the words of Mamie Till Mobley said it best. She said, when something happened to the Black people in the South, I said, that's their business, not mine. Now I know how wrong I was. The murder of my son has shown me that what happens to any of us anywhere in this world had better be the business of all of us. And as we look at this list of names that are here, what we are talking about is decades and decades of unmitigated trauma. This is just Minnesota. There are families that are behind these names that have been devastated, and some of these devastating experiences have happened in such close proximity to another that there's not even time to process, and there's not even time to grieve. And when you have a community that is in so much pain and experiencing an unrelenting form of trauma, left unmitigated, it will be disastrous. So I am hopeful, Madam Chair, that this is the last time that we'll have to come back and testify in support of this bill, and hope that we can finally make movement on this year. Thank you very much.
All right, well, thank you so very much, and thank you both. So House File 51 as amended is laid over for possible inclusion. So we will move now to Representative Richardson's next bill, which is House File 1059, and the chair will move that House File 1059 be laid over for possible inclusion. So Representative Richardson, shifting gears.
Thank you, Madam Chair. So House File 1059 is focused on supporting healthy prenatal development and healthy postnatal development of infants. We know that in Minnesota, we continue to have persistent and unacceptable disparities of infant mortality and morbidity. Many of us have heard the heartbreaking statistics that Black and Indigenous infants are twice as likely as white infants to die before their first birthday, reflecting decades of preventable health inequity. This is also a racial disparity that is actually wider than it was in 1850. 15 years before the end of slavery, when most Black women in this country were considered chattel. It's important to note that these gaps in infant death rates persist even when you account for healthcare access and other risk factors, like general overall health, substance use disorder and mental health status, familial status. The disparities still exist. In fact, education and income offer little protection. The gap is so huge that Black women with PhDs are more likely to lose their infant than white women with less than an 8th grade education. We have been tracking infant mortality rates since the 1800s, and the disparities continue to persist. And it forces us to confront the question, what will it take for us as a state and a nation to care for and protect our vulnerable infants? As only recently has the unacceptable disparity been recognized as a public health crisis and been acknowledged as being a preventable crisis. The question of what it will truly take to address this crisis becomes even more striking with the published research from Dr. Hardiman from the University of Minnesota that shows when Black newborns are treated and cared for by Black pediatricians, the newborn survival rate increases significantly. In fact, when Black newborns are cared for by Black pediatricians, their death rate is 1/3 lower. The size of this mortality reduction would correspond with preventing the in-hospital deaths of about 1,400 Black newborns nationally each year. As we seek to close persistent racial gaps in birth outcomes, we know we need culturally specific strategies focused on prevention and focused on support, and this bill is just one piece of that puzzle. This bill would continue an appropriation to the Wilder Foundation's African American Babies Coalition program to continue its community-led training, education, and best practices for our health, prenatal, and postnatal development, especially for communities with some of the greatest disparities currently being experienced related to infant mortality and morbidity. Today, I have with me Angela Moore-Smith, who is set to testify on the bill.
All right, thank you. Angela Moore-Smith, if you would please come down and go ahead and introduce yourself for the record and go ahead with your testimony. Welcome to the committee.
Good morning, Madam Chair and members of the committee. My name is Angela Moore-Smith. I am the Senior Program Associate for the Wilder Foundation's African American Babies Coalition and Projects, also known as AABC.
And Ms. Moore-Smith, you might need to pull the mic just a little closer. I think you have a soft voice and our mics are not very strong. Thank you.
No problem. Also known as AABC. I'm responsible for the recruitment of our community trainings as well as our communication and media. I am also a local resident, former early childhood education educator of 10 years, a wife, and a mother of 4-year-old twins. I'm here today in support of House File 1059. The provisions in this bill will help AABC to continue to build capacity in, train, educate, and improve practices among Black, Indigenous, and persons of color during pregnancy and postpartum. AABC began in 2005 with the mission of addressing Black and brown families' awareness of healthy brain development. This began after gestation, during delivery and postpartum, and throughout a child's life. AABC's work is centered in prenatal care, social determinants of health, focused awareness of parenting and reducing the education and economic gaps in Black and brown communities. AABC is working to create an equitable healthcare system that has the capacity to provide culturally responsive care so that Black, Indigenous, and families of color can thrive. We have developed in the past 2 years added work to our responsibilities. This includes the development of 3 training curriculums, culturally responsive focused care for healthcare workers, community members, and families, provide healthcare and university customized staff trainings and public trainings, action luncheons, summits, forums, and advancement gatherings. We have also piloted and created 2 early childhood education library sites to promote early literacy and nighttime bonding with caregivers and children. We have also partnered in creating and distributing a My Baby and Me baby bag for postpartum mothers and newborns. We have contributed material for the Women's Economic Security Act and continued media, as well as hosted a successful annual 2-day Black and Brown Birth Conference with over 175 people in attendance. Black, Indigenous, and communities of color face persistent health disparities in our birth outcomes, and from mortality and child development stemming from lack of high-quality, culturally sensitive prenatal, delivery, and postpartum care. Research shows us that in Minnesota, according to the March of Dimes, in 2021, 1 in 10 babies were born preterm. 1 in 14 babies were low birth weight. And in 2019, 299 infants died before reaching their first birthday. An infant mortality rate of 4.5 per 1,000 deaths. During 2017 and 2019, the mortality rate per 1,000 deaths in Minnesota was the highest for American Indian and Alaska Native infants at 11.5, followed by 8.5 for Black infants, 6.3 for Asian Pacific Islanders, and 5.9 for Hispanic infants, compared to 3.6 for white infants. Voting in favor of this bill will help AABC's work to help mothers of color have better access to referrals for specialists and other resources and services that they need. Increase access to high-quality services in communities of color. Help us to assist clinics and hospitals by providing trainings so competency keeps building and not just at the bare minimum. Help to train hospital administrators in prioritizing Black, Indigenous, and mothers of color. Provide healthcare and child care providers with access to the best science evidence to guide their care. And last but not least, this bill will help us to meet our long-term goal and our mission for disparities in prenatal, birth, and early childhood outcomes for Black, Indigenous, and babies of color in the state of Minnesota to be reduced or eliminated, because our babies deserve better. AABC and projects are intended as a vehicle for easy access to guide mindfulness, a safety net with an opportunity to design innovative tools to help our community thrive. We are very proud of our connected-based work, and we hope you will join us in our work to be extended and implemented. Thank you, Chair Liebland and members of the committee. I urge you to vote in favor for 1059. I'm happy to answer any questions the members may have about our program at AABC. Thank you.
All right, well, thank you for your testimony. Is there anyone in the audience who wishes to testify on the bill? Okay, I'm not seeing anyone. We do have a question from Representative Bahner.
Thank you, Madam Chair, and thank you, Representative Richardson. And I guess it's basically more of a statement, I guess, than a question, and a gratitude. I really want to thank you for bringing this bill forward, and for Ms. Smith for her testimony. You know, I think that, you know, you discussed the impact of this potentially being about 1,400 newborns nationally across the country. And I can tell you from my own experience that one of my best friends from college, she is African American, our true Southern belle, highly, highly educated woman, very brilliant. But I remember when she was pregnant with her first child, she had some issues with serious hypertension, as well as other complications, and had to be put on immediate bed rest. Though she resisted at first, we impressed upon her that we would be there to support her and to help her through all of this. But I think one of the things that I recall from that time is that there was a concern that there were some individuals who thought that maybe she was overdoing it, overreacting, that maybe this wasn't legitimate. Fortunately, she had a wonderful physician and incredibly supportive friends who said, we absolutely want you to be safe. We want you to have a healthy baby, and we will do whatever is necessary to make sure that happens. But I know that not everyone has that experience. And I think this bill aims directly at that issue, that not everyone has the best advocates on their side. Not every individual has folks who are attending to them who are properly trained, who understand some of the implications of these issues, and not everyone has the support structure that Michelle had. And without that support structure, I have no doubt that there is a high probability that we might not have had Anigan and Audrey with us today, who are, by the way, now ready to go off to college and exceptionally intelligent, wonderful humans. And so thank you for this bill. Thank you for bringing this forward. And I'm really appreciative. And I do want you to know that I have signed on to this bill, Representative Richardson, and I am in firm support of it. Thank you.
All right, thank you. So we have Representative Bahner, and then we're going to lay the bill over. Representative Bahner.
Yeah, thank you, Madam Chair, and Representative Richardson. First of all, thank you. This is something that I personally agree upon. Whenever we can help the lives of unborn children, of all unborn children, that's something we can agree upon. So thank you. My question deals is more specific on this. What does this program do to help improve the outcomes for pregnant women of color compared to existing programs that address health needs of mothers? If you could address that, I would appreciate that. Thank you.
Representative Richardson.
Thank you, Madam Chair. Thank you for the question. So the African American Babies Coalition is unique in many ways. It's a culturally specific program that has been designed to work towards addressing disparities that we see not only within the Black, Indigenous, and within other communities of color, but they also have an award-winning Brains Are Built program that has garnered national attention. As we look to what is happening within our state from a maternal mortality perspective, with Black women being 3 to 4 times more likely to die from pregnancy-related causes, and with Black and Indigenous infants being twice as likely to die before their first birthday, I think it's important that we keep at the top of our minds that the vast majority of these deaths are preventable. We don't have to have the numbers that we currently have within the state, and we don't have to have the numbers that we currently have within this nation. And if you look to the Centers for Disease Control, they have great research out there that demonstrates that over 80% of the maternal mortality deaths within this nation are in fact preventable. So what this program is doing that is unique is focusing not only on those supports, but on prevention, but also providing bridges for providers to also be able to hear firsthand from families and to understand the impact of these disparities. So it's an opportunity not only to support families, but to ensure that our provider community is also moving in the right direction as well.
All right, thank you. Representative Quam, and then we're going to move on to the next bill. Representative Quam.
Thank you, Madam Chair. And I had a good friend that I worked with who came over from Asia. Took years to get his wife over. They got married. They had a child. And he really helped me to understand there are so many different cultures in the Asian countries. There's a lot of differences, just as there are among African nations. And the testifier talked about cultural aspects and referenced Asian countries. Noticing the name of the grant recipient, can you enlighten me on some of the aspects in which you assist the different Asian people with different Asian cultures to, with your program?
Representative Richardson, or do you want to turn it over to testifier?
I can start, Madam Chair. So in terms of the way that the African American Baby Coalition approaches its work, just like the Brains Are Built campaign, it is widely applicable. We know that all infants have rapid brain development within those first few years of life. And as we look towards convenings, those are diverse convenings as they're reaching out to providers. They're bringing messages that share the disparities that are across those different communities. And I don't know if there's more that the testifier would like to add to that as well.
Ms. Moore-Smith?
Thank you. I would like to add that we also are a member of the Birth Justice Collaborative in the Twin Cities, and that is a diverse group as well, and we serve that population as well. So I just want people to know our name is AABC, African American Babies Coalition, but we serve all babies. Our primary focus is definitely helping with the disparities of communities of color, but not to get our name misconstrued with the population that we serve. We're here to support all babies.
Madam Chair.
All right.
I just wanted to make sure that we got on record that it was more global than what some people might assume.
Yeah. All right. Thank you. And thank you very much, Representative Richardson. With that, we're going to lay over House File 1059 for possible inclusion. Thank you very much. Thank you to Ms. Moore-Smith. All right, we're running a little bit behind, but we're going to move now to House File 639, Representative Bahner. And Representative Bahner is going to move that House File 639 to get it before the committee, and this will be laid over for possible inclusion in an omnibus. So welcome to the table, Representative Bahner, and I don't think there is an amendment, so please go ahead and present your bill.
Yes, thank you, Madam Chair. That is, in fact, my motion. Hello. Let's see. And with that, I will dive right in because I know we have some time constraints today. Madam Chair and members, House File 639 provides funding for the Community Solutions for Healthy Child Development Grant Program through the Minnesota Department of Health. The focus of the program is to improve the measures of well-being for Minnesota's children of color, as well as American Indian children from prenatal to age 8, through community and equity-centered approach. Minnesotans are proud to be leaders in the nation for overall well-being for children. However, if we look at outcomes for children of color, we rate in the bottom third. Children of color are the poorest Minnesotans with vast racial disparities amongst our Black, American Indian, Latino, and Asian American children. This is simply unacceptable. The Community Solutions Grant Program is a strategy which we can begin to address disparities upstream. It leverages our community assets to address these problems and bring those most impacted into the decision-making process. In 2019, the legislature created a pilot program whose goals were threefold. First, to improve child development outcomes. This includes early learning, health and well-being, economic security, and safe, stable, nurturing relationships and environments. Second, reduce racial disparities in children's overall health and development. And third, to promote racial and geographic equity. The mission of the program is to fund community-based solutions and address challenges clearly identified by the impacted communities, while delivering strategies that are culturally efficient and relevant services to communities of color and Indigenous communities. Eligible grantees include organizations, nonprofits, or tribal nations. that are either led by or directly work with these communities. We must recognize that to achieve this, we must build authentic community partnerships and fund trusted organizations led by the very groups that they serve. The state has appointed the Community Solutions Advisory Council, or CSAC, to advise and assist Minnesota Department of Health with the development and implementation of the RFP process and the selection of the grantees. The council will continue to advise MDH on the management of the grant program moving forward. And the CSAC, comprised of diverse communities representatives with a high level of expertise in the areas of child development and community intervention services. Finally, we are requesting funding to make community solutions available in every community in Minnesota. This pilot has shown great promise, and now is the time to scale this concept to provide life-changing opportunities for every child here in Minnesota. And with that, Madam Chair and members, there is some additional information in your packets for you on the programs themselves. And I do have my first testifier here today. I will let her identify herself for the record and proceed.
All right, thank you very much. Please go ahead, identify yourself for the record. Please proceed.
Thank you. Thank you, Chair Liebling. Good morning to you and the committee. My name is Diane Halsey, and I am President and CEO of the Family Partnership in Minneapolis. And I also have the pleasure of being the co-chair of Voices and Choices for Children Coalition. Voices and Choices for Children is a coalition focused on improving outcomes for children of color and American Indian children ages 0 to 8. We are focused on the implementation of policies and practices that meaningfully highlight the opportunities that exist in the state of Minnesota. We support HF 639 because we know it to be a strategy that amplifies the innovative solutions that leverage community assets that are culturally relevant and center the experiences and dignity of those most impacted by inequity. We stand with the governor and the legislature in your efforts to make Minnesota the best place to live for all families. Unfortunately, we recognize that for many families of color and American Indians, Minnesota is not a healthy place to live. We are committed to change that. Community Solutions Grant Program represents more than just money. It is a recognition that communities of color, American Indian communities, and geographically dispersed communities have invaluable knowledge and must be active and valued participants within the creation of solutions for themselves. In 2015, there was a statewide report titled Recommendations for the Well-Being of Families of Color and American Indian Families in Minnesota. There are a couple of key findings from that report that was a report of over 20-year period that inspired the creation of the Community Solutions Fund. One of those things are that the community-led solutions are effective in improving family well-being and promoting health equity. Yet, the solutions of Indigenous communities and communities of color are largely unfunded. The second one is having culturally specific caregivers, providers, and services positively impacts the identity formation of all children and creates protective factors for healthy child development. We piloted the program beginning in 2019, as has already been mentioned, and even though many of the grantees had to implement the program in the middle of a global pandemic, we are seeing great results. We believe that it is because communities have the flexibility to design solutions to the issues in their own backyards. We know that sustained funding is the key to make sure that we are continuing to build positive outcomes over time. It is imperative that communities are able to access the funding beyond the pilot. So we strongly encourage you to support HF 639. The collective health and prosperity of our state is ultimately tied to ensuring every child has what they need to thrive. Thank you.
All right, thank you very much. I also have Diana Alvarez. Welcome. And then Shelley Huang. Yeah, welcome to the committee. If you would just state your name and go ahead.
Yes. My name is Diana Alvarez. I'm the Early Childhood Programs Director at Centro Tyrone Guzman. the oldest and largest organization in Minneapolis. For more than 45 years, Centro Tyrone Guzman has been a space for transformational experience through a holistic approach to education, health, and wellness for the entire families, Latino families in Minnesota. Minnesota is home to some of the largest educational disparities in the nation between Latino and white students. These disparities begin at an early age. In Minneapolis, data has shown that the Spanish-speaking children are the least likely to be ready for kindergarten. Before our children even step foot in a kindergarten classroom, most Latino children in Minnesota are at a fair disadvantage because they have lacked access to high-quality, culturally responsive early childhood education. One of our programs is Siembra Montessori, an early childhood 4-star parent-aware rated program that provides early childhood education to Latino children aged 3 to 6 from low-income families. 5 years ago, Siembra Parent Leadership Committee emphasized the need to extend the support they receive to more parents and beginning earlier, from the conception of the child. With the support of the community grant, we could create a cultural responsive Montessori home visiting curriculum with the input of the community, the Montessori Center of Minnesota, the Dr. Mary Hurst from the University of Minnesota, who also helped us with the program's evaluation. Last semester, we served 32 families in our Montessori home visiting program, supporting parents on a bi-weekly basis to achieve their goals, and connecting them with resources they didn't even know that exist. So sometimes those resources are so important so the kids can be ready for kindergarten. If you want to learn more about the program, page 18, 19, information is there. The Community Solution Grant has given us the opportunity to create models for the community, by the community, to help minimize the educational gap of our children. We ask the community members to support the HF 639 bill so our children can receive the quality education and resources needed to thrive in Minnesota. Thank you.
All right, thank you for your testimony. And Shelley Huang? Welcome to the committee.
Hello. Hello, Chair Liebling and members of the committee. My name is Shelley Huang. I am a mother to a 3-year-old boy. I have been participating in opportunities that Hmong Early Childhood Coalition, also known as HEC, has provided since August of 2022. HEC is one of the grantees of the Community Solutions Grant Program. I am so grateful to be a part of HEC and for their support. My son has had a lot of allergies, severe eczema, and health issues that concern me. For the last year, I've been searching for help for him and also for myself as a parent. It has been hard to find support group and that understands my needs. I'm glad that I got to know HEC because being able to attend their culturally relevant trainings and community conversations has helped me understand my toddler's growth and development. Other trainings provided are on social emotional supports, health, and nutrition. I have a better understanding of how to support him in the way he deals with stress and trauma, in addition dealing with my own stress. HEC has provided me an opportunity to meet other parents and caregivers to open dialogue about our struggles and how we can better support our own children and our community. In addition to caring for my own child, I also care for my younger nieces and nephews, ages 1 to 3 years old. HEC's program for family, friends, and neighbor caregivers, also known as FFN, supports parents like me, as well as grandparents and other caregivers with information and resources to help their children learn and grow so that they can succeed. The materials and tools they provided me, such as books, building blocks, emotional cards in English and in Hmong, have been a great help so I can teach the children I am caring for. The resources and opportunities are so important in building onto our knowledge as Hmong parents and strengthening us as a community. We need more funding for programs like HEC so that more parents can have access to culturally relevant resources. Community Solutions Grant Program is the model that truly centers and understands the importance of our voice and the work of small community-led organizations such as HEC. Thank you for the opportunity to share my story today. Please support the Community Solutions Grant Program.
All right, thank you for your testimony. Is there anyone in the public that wishes to testify on the bill? Okay, not seeing anyone, so we'll go to, we have a one-member question or comment. Representative New Brindley.
Thank you, Madam Chair. I do have questions about the bill. I'm wondering, this program we're in the fourth year of this grant program, and so I'm wondering, Representative Bahner, if we have any results on it. I've been looking, I've been trying to find it, but has there been any reporting requirement? Where can we see the metrics that we were looking for how the grantees, how do we evaluate the performance of grantees? Where can we find those metrics? And in these 4 years, have the grantees been meeting those metrics?
Representative Bahner.
Thank you, Madam Chair, and I do have an expert that we will call down.
Welcome to the committee. Please give us your name and title and go ahead.
Hi, Madam Chair and members of the committee. My name is Ramya Palniappan, and I'm with the Minnesota Department of Health, and I'm the grant manager for the Community Solutions Program. And so we're actually in the third year of the grant program. As the first year, we were establishing the Community Solutions Council, so the grant started in 2020. So we're in the third year, and we've had a tremendous impact in these communities. So the Community Solutions' main goal is to improve healthy child development, and two main indicators that show progress in this are high-quality early care and education, and access to health care and dental care. So Community Solutions grantees work in both of these indicators. And as cited in the Minnesota Kids Count report from 2022, more than 50% of Minnesota children ages 3 and 4 are not in preschool programs. So we have 6 grantees who are working and providing early learning programs and training early childhood providers in culturally specific methods. An example of one of the grantees' impact is one of them provides a transitional classroom for older infants. And in this classroom, 99% of children were at or above developmental benchmarks. For the second indicator, as quoted in the School Readiness Consulting Report, which is a third-party evaluator who wrote a report on community solutions as a whole, and I believe that was provided to all members of the committee, 54% of Latina children and 34% of Black children do not have access to routine medical and dental care. And so right now we have 9 grantees who are working in healthcare access and providing dental care access. And an example of the impact of one of our grantees is one of our grantees has provided culturally tailored oral health care and education to over 2,600 BIPOC children and over 400 pregnant women. And from the first year of the pilot, we have seen over 13,000 individuals served by our grantees, close to 200 families, and over 5,000 with online educational resources.
All right, well, thank you for that. I almost like you were set up to come and answer that question. Representative New Brindley, do you have anything further? And then we're going to lay the bill over.
Thank you, Madam Chair. I actually really appreciate that. Frankly, I was a little frustrated that we haven't been able to find those metrics. And frankly, because of that, I was really skeptical of the bill because I thought, well, we have lots of grant programs that we like to throw more and more and more and more money at that, frankly, are not effective. They're really not effective, but we keep giving them more money. So I really appreciate what you just had to say because you gave very clear indicators of how this has been used effectively.
All right, thank you. Representative Nadeau?
Just one really quick question on eligibility. And I too love evaluations, so I'll find the evaluation report and read it, and I'm looking forward to that. So in the eligibility for grant recipients moving forward, it talks about organizations, entities that work with communities of color, African American, or American Indian communities. Would the county that I live in, county that I work in, does a lot with communities of color and Native American communities. Would Hennepin County be an eligible grant recipient of these dollars? And if that's a no, which is fine, would an organization that we are part of, like North Point Wellness, would that organization be an eligible grant recipient of these grant funds?
And Representative Bahner, or to the testifier?
Thank you, Madam Chair. So in terms of eligibility, we really look at organizations that are led by communities of color and Indigenous communities. So I think with those organizations that were mentioned, I think we would want to see if they met those eligibility requirements and see if they have the same goals as the grant program to determine if they would be eligible.
Okay. All right. Thank you very much. Thank you, Representative Bahner. So with that, House File 639 is laid over for possible inclusion. Appreciate all of the testimony. Representative Reyer, House File 712. And Representative Reyer's motion will be that House File 712 be laid over for possible inclusion. And I don't see an amendment, so I think Representative Reyer, you can go ahead and present your bill.
Thank you, Madam Chair. Thank you, committee members. House File 712 will include increased funding for family planning grants by $7.9 million per year. The Family Planning Special Project Grants has been in existence for 45 years, providing access to culturally appropriate, evidence-based family planning services, including counseling and education, contraception services, preconception care, supporting healthy pregnancies, and screening and treatment for sexually transmitted infections, or STIs. Funding is provided statewide and is especially important in rural areas and communities with barriers to accessing services such as poverty, lack of insurance, or transportation challenges. These services are an investment in health in the communities where they are offered, as family planning services reduce the incidence of unwanted pregnancies, STIs, infertility, and cervical cancer. These are the services Minnesotans need to make healthy reproductive choices. Now I'd like to introduce Becky Twomley, Executive Director of We Are Clinic in Brainerd and Board Chair of the Reproductive Health Alliance, to talk more about the impact of family planning grants on clinics throughout the state, and then we'll look forward to your questions. Thank you.
All right, thank you. Welcome to the committee. Please just state your name and go ahead.
Thank you, Madam Chair, committee members. My name is Becky Twomley. I am the Executive Director of We Are the Clinic in Brainerd, Minnesota, and the Board Chair of the Reproductive Health Alliance. RHA is a coalition of 44 member organizations, individual providers, and advocates focused on the problem of inadequate funding for sexual and reproductive health care across the state. Our priority for funding is the family planning grant outlined in House File 712. We strongly support the $7.9 million increase for funding of the family planning grant. While the need is growing and STI rates are rising, funding for clinics to address these issues is not keeping up. In over 20 years, this grant funding has increased only 5%. This doesn't take into account inflation or wage increases or the ability for a new clinic or program to access funding. Funding family planning saves taxpayer money through a decrease in teen and unwanted pregnancy rates, reducing the incidence and impact of preterm and low birth rates, and reducing rates of STIs, HIV, infertility, and cervical cancer. This investment of public dollars is equivalent to an estimated taxpayer savings of $7 for every public dollar spent. Clinics across the state just completed a 5-year application for the family planning grant. Awards went to 33 clinics out of 43 applicants. These unfunded clinics are providing services to some of the most vulnerable Minnesotans. A clinic serving American Indian clients in Minneapolis was not funded. The only clinic in the state providing services for deaf, hard of hearing, and blind patients was not funded and forced to discontinue programming. The only clinic in a northern suburb that has served over 1,000 clients per year for over 40 years was not funded. The current funding model is inadequate to meet the needs of Minnesotans and to compensate those providing high-quality, culturally competent, accessible reproductive health services. Affordable access to reproductive health care is critical for vulnerable populations, youth, young adults, BIPOC and LGBTQ+ communities, the underinsured, and the uninsured. This is even more important in rural areas where transportation, stigma, poverty, and lack of insurance may be more pronounced. If I had more time, I could tell a number of stories of patients who were denied contraception and STI testing based on their age, inability to pay, or the provider's ideology. These are critical barriers to accessing care, especially in rural areas. Funding is important to fill the gaps and to help us meet our clients' needs. The $7.9 million increase will allow funding for new projects and programs, potentially increasing access to contraception and STI testing across Minnesota. In fact, 47% of Minnesota counties have no family planning clinic, and patients must drive long distances for care. Funding will have an impact on STI rates through increased access to affordable testing, treatment, risk reduction counseling, and condoms. This is important because although they account for only 6.5% of the population in Minnesota, adolescents 15 to 19 accounted for 25.2% of chlamydia and 16.3% of gonorrhea cases. People of color continue to be disproportionately affected by all STIs in Minnesota, and access to health care with preventative screening and due to differences in health care insurance coverage, employment status, and access to health care with preventative screening and treatment services. And I'm happy to share more of those statistics if you'd like them later. Funding will increase access to youth-focused reproductive health services that are proven to increase the likelihood of youth attaining education and career goals, raising socioeconomic status and decreasing poverty rates, as well as improving health outcomes for all genders. Funding will compensate clinics fairly and allow small nonprofits to compete in the healthcare market. While ultimately this investment will save taxpayer dollars, access to family planning affects Minnesotans' education and workforce participation, as well as subsequent outcomes related to income, family stability, mental health, happiness, and children's well-being. We are proud to live in Minnesota, a state that prioritizes affordable reproductive health care. We urge you to take this opportunity to support House File 712. This funding is critical to the sustainability of our organizations and to the health of our communities. Thank you.
All right, thank you for your testimony. Is there anyone else who wishes to testify on the bill? Okay, not seeing anyone. So Representative Nadeau.
Thank you, Madam Chair. Quick question. It's two-part, kind of. Can you talk a little bit about, I'm assuming that this is an amount of money that significantly is leveraged in the community with other partners. Can you talk a little bit about how that happens, and also who some of those partners are that these grant recipients are working alongside, be it counties, local gov, tribal communities, health plans, foundations, or are these literally just standalone? I guess I just assumed that they work together. So could you talk to that a little bit?
And Representative Reyer, did you want to take a stab at that, or do you want Ms. Twomley to?
Thank you, Madam Chair. Thank you, Representative Nadeau. Do you mean who they are partnering with to provide services or for additional sources of funding?
Representative Nadeau.
Yeah, thank you, Madam Chair. And actually, both. You know what I mean? I know that I'm very familiar with my county. I'm very familiar with the work that we do in this regard, and I'm assuming that those partnerships extend across the state as well, and that's what I guess I wanted you to talk about, is the leveraging and then the partners that these grant recipients work with to ultimately achieve the goals that are set out.
Ms. Twomley.
Sure. Thank you, Madam Chair and Representative Nadeau. I think it varies based on where you live and what county you live in. Certainly, the Family Planning Grant, or FPSP, does not, I think, for any organization in RHA, cover all of the expenses. So we are all writing grants, working with foundations, garnering local support. I can speak to my own organization in Crow Wing County. The FPSP grant pays for about half of my salary, which is about 35% of my budget. And I think that can range depending on the size of the clinic and the size of the county and the number of, clients that are served. If I'm speaking for all of the clinics within RHA, certainly we are collaborative by nature. We are working with the county, public service when we can. We're working with organizations that work with at-risk teens. We're working with women's shelters. We're working with BIPOC communities, providing education and services in a variety of ways. So I think there are many partnerships, I think, on both levels, but they look a little bit different depending on if you're in rural Minnesota or in the metro area.
And Representative Reyer wanted to add to that as well.
Thank you, Madam Chair. Yeah, I would like to add that, in fact, sometimes the grants are going to counties or cities or nonprofits. So as our testifier said, it varies, but I think you can expect it to be part of an ecosystem in a community that reflects the community.
Representative Nadeau?
Yes, and thank you. And the reason I bring it up, it's super complex, and this is a pretty simple bill. And what I want us to remember and focus on is that there's a number of organizations that are focusing on these issues and how we work together and how we leverage these things. And it would actually be nice at some point to see the overall investment that we're making, and along with measuring the impact that we're having. You put out a bunch of statistics earlier, and areas of concentrated poverty have a tendency to be worse in those statistics than others. And which of those organizations and which of those interventions are focusing there and are actually changing people's lives? Those are the things that I think that we need to talk about and show so that we can justify those investments. Thank you for answering the question, and I'm sorry I went on there a little bit, but thank you.
Yeah, thank you, Representative Nadeau. And I think those are good questions. I mean, I actually have a couple of questions of my own just to clarify. So obviously, one way that we support family planning is through our medical assistance program for those who are on that program. We pay, to his question, I think we pay for medical services for some populations, but I think, as you noted, there are a lot of people who are not covered for one reason or another. But could you just explain, and I do understand that the ecosystem there are a lot of different ways that this funding flows, and as you were just talking about. But so in organizations where people come in and they do have some kind of insurance, how does this funding that we're talking about kind of fill those gaps? Does their insurance still get billed for the service? How does that exactly work? Ms. Twomley?
Sure. Thank you, Madam Chair. Certainly, there's a lot of different scenarios. We do bill insurance. I would say that we're lucky as a nonprofit, many of us in the nonprofit world, that we have that ability to generate some revenue. However, it doesn't cover all of the expenses. So I would make that point. It covers maybe 25 to 30% of our expenses. So when we do bill insurance, when we do have an opportunity to bill private pay insurance, we also have an opportunity to enroll those that qualify in the Minnesota Family Program, which is part of the medical assistance program, and there's income qualifications. It's a confidential program. Many of us are the only institutions in our counties or our areas that will enroll clients in the Minnesota Family Program, Family Planning Program. So that is a great safety net that we have in Minnesota, providing confidential care, especially for young adults who maybe really, want that confidentiality. So I think the answer to your question is yes, we bill insurance when we can. Yes, we enroll anyone that we can in the Minnesota Family Planning Program. Certainly, some of the folks coming in the door already have some state-subsidized insurance. And again, in Minnesota, I think we're lucky that we have, so many options. Where I live in rural Minnesota, there's many underinsured or uninsured folks. We have a service economy, so I think, we'll find a lot of that too. So we're sort of filling the gap. So this grant funding really, it provides salaries for the clinics. It fills in the revenue that we're not getting when we do, really complicated, maybe STI testing and contraception, and we're not really getting reimbursed for the full costs of the services we're providing.
Okay, and then finally, where does this number come from, the 7.9? I mean, I don't know, Representative Reyer, was that part of the governor's budget, or why that number, not some other number?
Thank you, Madam Chair. It is part of the governor's budget. It's close in amount to the governor's amount and reflects the needs as the organization had gone through and looked at the number of people who needed to be served, the amount of access that was needed.
Okay. Well, thank you very much. I think this is a program that does fill gaps, and I don't know that there's any other in Minnesota that does fill these gaps. And I think, as it was Representative Reyer noted, it's been underfunded for a long time. So thank you very much. And so with that, House File 712 is laid over for possible inclusion. So we have just a couple minutes. I think we're going to just not go forward with 1030 today, which is my bill, because we only have just a very few minutes, and we will put that back on the agenda at another time. So with that, we will see you all on Thursday, and we are adjourned.